Hello everyone, welcome to the Medic World Study with Dr. Mahi. Today we are going to discuss the previous year questions of NEET PG 2019 of the subject Anatomy. So let's start with our first question, that is, the movements at the dash joint permits a person to look to the right or left, means for the no movement. Let's see the options. The first option is atlanto-occipital joint. It is used for the yes movement or moving the head up or down. So it is not the answer. Now the next option is atlanto-axial joint. It is used for the no movement or right or left movement of the head. So the answer to this question is option B. Now the next question. All of the following are true about the right coronary artery except. We have to notice the word except means we have to find the false statement. Let's see the options. Its diameter is less than the left coronary artery. Yeah, it is the true statement because right coronary artery has less diameter. Now, the next statement, it arises from the anterior aortic sinus. It is also the true statement. It gives rise to the circumflex coronary branch. It is the false statement. Right coronal artery is its first branch. It is also the true statement. So the answer to this question is option C, that is, it gives rise to the circumflex coronary branch. It is the false statement about the right coronary artery. Now the next question. What is the basis for the formation of omphalocele? Omphalocele. First of all, we have to identify the condition omphalocele. It is a defect which is of 2 to 15 centimeters in length. Small bowel, stomach, colon, and liver are protruding out of the abdomen, and these all structures are covered by a sac. Always there is a sac in the omphalocele, versus if we seen in gastrostasis, sac, no sac is there. Okay. Now, we are asked in the question that what is the basis for the formation of this omphalocele? Let's see the options. Excessive length of the intestine? No, it is not the basis. Physiological hernia failing to go back? Yeah, it is the answer to this question because in omphalocele, the hernia which has to go back in the embryo, it fails to go back. That's why it represents as omphalocele. Now the next question, which fiber is marked by the arrow in the image given below? We have to identify the fibers first. Here in the image, yes, we can see the fibers which are marked below. These are the fibers and these are the fibers of internal capsule. Let's see the options. Short association, long association, projection, or commissural fibers. Internal capsule is not in the option, so we all know that internal capsule fibers are the projection fibers. So the answer to this question is option C, that is projection fibers. Now the next question. Which nerve passes through the foramen marked in the image below? First of all, we have to identify the foramen. This is the mandibular bone, mandible, and the foramen which is marked is the mandibular foramen. And the nerve which is passing through this foramen, it's the inferior alveolar nerve. We have to find this nerve in the options given, and lingual nerve, no. Mandibular nerve, no. Chorda tympani nerve, no. The answer is the D, that is inferior alveolar nerve. Now, boundaries of Gallert triangle are formed by all except. We have to know the boundaries of Gallert triangle. Gallert triangle is formed by three C's. Medially, there is common hepatic duct. inferiorly we have cystic duct, and superiorly we have cystic artery. Now let's see the options to find our answer. Common hepatic duct, yeah, it forms the medial boundary. Cystic duct, it forms the inferior boundary. Cystic artery, it forms the superior boundary. Gallbladder, no, it doesn't form the boundary of Keller triangle, so it is the answer. Now the next question. Area marked in the given image is supplied by the dermatome number. First of all, we have to identify the marked area. The area which is marked in the image is covering the umbilicus. We all know the dermatome supplying the umbilical region is the T10. So the answer to this question is option C, that is T10. Now the next question, the arrow in the image denotes which of the following muscles? Here in the image we can see the muscles are shown of the posterior compartment of the forearm, and in the posterior compartment we have extensor muscles, and the muscle which is marked is on the radial side, so it is the extensor carpi radialis, and it is the longer one, so it is the extensor carpi radialis longus. So the answer to this question is option A, that is extensor carpi radialis longus. Now the next question. What is the nerve supply of the structure marked in the image below? In the image, the structure which is marked is the lumbrical, and it is the second lumbrical, and we are asked about the nerve supply of this structure, means nerve supply of the second lumbrical is the median nerve. We all know this. And the other two lumbricals on the medial side are supplied by ulnar nerve. So the answer to this question is median nerve, that is option B. Now the next question. Nerve supply of the area marked by the arrow in the image is. Here in the image, the area which is marked is this, and the nerve supply of this region is the radial nerve. So the answer is option A. Now the next question. Cholecystosvena line separates which of the following? We all know the cholecystosvena line is also known as the Cantilese line. It is an imaginary line that divides the liver into two planes. It starts from the cholecysto, means gallbladder. Okay, so it extends from the midpoint of the gallbladder fossa. Okay, at the inferior margin of liver, back to the midpoint of vena cava. Okay, vena cava to vena cava, inferior vena cava, and it contains the middle hepatic vein, gallbladder fossa to the midpoint of IVC, and it is the Cantilese line, and it separates the liver into two halves, that is right and left lobe of liver. So the answer to this question is option D, that is right and left lobe of liver. Now the next question, which of the following is false about the skin? The options are dermis is derived from ectoderm. No, it is the false statement because dermis is derived from mesoderm. Let's see the other statements. Skin accounts for 15% of total body weight. Yeah, it is the true statement. Epidermis is derived from ectoderm. It is the true statement. Dermis is made up of type 1 and type 3 collagen. It is the true statement. So the answer to this question is option A. Now the next question. All of the following structures are derived from the aponeurosis of the external oblique muscle except. Let's see the options. We all know that aponeurosis of external oblique muscle forms pectineal ligament, inguinal ligament, and lacunar ligament. Let's see the options. Pectineal ligament, yeah, it is derived from the external oblique muscle. Inguinal ligament, yeah, it is derived. Lacunar ligament, it is derived. But linea semilunaris, it is not derived from the external oblique muscle aponeurosis because it is derived from the internal oblique aponeurosis. Now, let's move towards the other question. Which of the following lobes of the prostate forms the uvula vesicae? We all know that median lobe of the prostate forms the uvula vesicae. What is uvula vesicae? Uvula vesicae is an elevation in the mucous membrane of urinary bladder behind the internal urethral orifice. It is often enlarged in the cases of benign prostatic hypertrophy. So the answer to this question is median lobe. We all know that uvula vesicae is formed by the median lobe. Now the next question. Foot drop is caused by damage to which nerve? Foot drop is caused by the damage to the common peroneal nerve. We all know. Let's find it in the options. The first option, that is the common peroneal nerve. Now the next question. Which of the following is true regarding D. Quervain's tenosynovitis? Let's see the options. Fingers are held in mild extension. No, it is the false statement. It affects adductor pollicis longus and extensor pollicis brevis. It is the true statement. Most common involvement is index finger. No, it is the false statement. And the treatment is surgery. No, it is not in all the cases. So the answer to this question is option B. Now the next question. Identify the structure marked B in the image given below. Here in the image, we can see this. There is a structure marked as A. This structure is the corpus callosum. The structure which is marked B, that is this structure, is the fornix. And the structure marked C, here this structure is the pituitary gland. So the answer, let's see the answers. The structure marked B is the fornix. So the answer to this question is option C, that is fornix. Now the next question. First pharyngeal arch gives rise to all of the following except, let's see the options. Medial pterygoids, levator velli palatini, lateral pterygoids, and tensor velli palatini. We all know the muscles of mastication, that is, the muscles of mastication. Temporalis, masseter, lateral and medial pterygoids. All these are derived from the first pharyngeal arch. So, except it is derived from the first pharyngeal arch, it is derived from the first pharyngeal arch. And the tensor tympani and tensor velli palatini are also derived from the first pharyngeal arch, tensor tympani and tensor villi palatini. So it is also derived from the first pharyngeal arch. So the answer to this question is levator villi palatini because it is not derived from the first pharyngeal arch because it is the muscle of soft palate which is derived from the fourth pharyngeal arch. Thank you so much.